Welcome to the Heart Talk, a podcast dedicated to empowering you with the knowledge and habits that keep your heart strong and healthy. In today's fast-paced world, where stress is high, lifestyles are sedentary, and processed foods often replace wholesome meals, heart disease has become one of the world's leading health concerns. And alarmingly, it's affecting younger people more than ever before. Hi, I'm Huma Qureshi, and in this episode, we're joined by a leading physician to help us understand how we can protect our hearts, detect early warning signs, and make choices that ensure a longer, healthier life. Together, we break down the science into simple, actionable steps that you can start today, because a healthier heart means a healthier you. So, doctor, tell me, why are so many people today, younger people, even celebrities, getting heart attacks at just 40? I mean, aren't heart problems for older people?
Huma ma'am, actually it is a good question. Heart attacks in young adults are increasing due to diabetes, obesity, smoking and stress. Even fit-looking individuals may have hidden risk factors like high cholesterol or genetic predisposition. Studies show that 25% of heart attacks in India occur in people under 40 years. South Asian are at higher risk due to genetics and lifestyle factors.
So, what are the warning signs that I should never ignore when it comes to my heart? And when should I see a doctor?
Yes, Uma ma'am, it is a relevant question in our daily life. Actually, if you have chest pain or chest discomfort, shortness of breath, or fatigue without any reason, pain radiating to left arm, neck, jaw, or back, palpitation, dizziness, or fainting, you have to consult your nearby doctor as soon as possible. Early detection saves lives. Delay in treatment increases mortality significantly.
And what are the most important daily habits that people can adopt to keep their heart healthy and to reduce the risk of heart disease? And what are the daily habits that people can use to keep their heart healthy
Yes,
and
Huma
reduce
ma'am,
the risk
we
of
have
heart
to know
disease?
the important daily habits to prevent heart problems. Eat a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Exercise at least 150 minutes per week. Moderate activity means brisk walking. You can do 30 minutes per day for 5 days in a week, or you can do vigorous activity at least 75 minutes per week. Vigorous activity means swimming, running, jogging, cycling. You have to quit smoking, reduce alcohol intake, maintain healthy weight, monitor blood pressure and blood sugar, and you have to do regular screenings after age 30 in high risk groups. High risk group means if there is a positive family history of heart attacks, or if there is associated hypertension, diabetes, obesity.
How much do diet and physical activity actually affect your heart health, and what are your top recommendations?
Yes, Huma ma'am, it is a good question. Actually, up to 80% of premature heart disease is preventable with healthy diet and exercise. DASH diets reduce risk of cardiovascular events significantly. DASH diet means dietary approach to stop hypertension. It includes green vegetables, green and leafy vegetables, low or fat-free dairy products, dry fruits, fresh fruits, avoid oily foods. Regular activity improves blood pressure, cholesterol, and insulin sensitivity. But remember that consistency in activity is more important than intensity.
What about stress? Does stress actually affect the heart, and what are the practical steps that one can take to reduce it?
Yes, Huma ma'am, it is a relevant question in our life. Actually, chronic stress increases blood pressure, inflammation, and risk of arrhythmia. Stress related heart disease is well documented among young professionals. Mindfulness, yoga, meditation, deep breathing, adequate sleep can reduce the stress in our lives. Social connections, counseling help lower stress burden.
Well, as we wrap up today's conversation, remember your heart's health is in your hands. Every small change you make, from the food you eat, the way you move, and how you manage stress, adds up to a stronger, longer life. We hope the insights have inspired you to take those steps starting today. After all, your heart works for you 24/7. It deserves the same care and commitment from you. Thank you for tuning in. Until next time, keep your heart happy and it will keep you going strong.